Dr. Nadhna.
Good evening. I'm presenting my paper titled The Outcomes of Single Step Trans-PRK. Conventional PRK involves removal of epithelium, corneal epithelium through mechanical methods. Trans-PRK uses excimer laser to remove the epithelium. It occurs in a single step and no-touch technique that improves the accuracy and precision. The advantages of trans-PRK other than that are shorter operative period, reduced post-operative discomfort, faster visual recovery, and absence of flap-related complication. Thus, it is safe procedures in thin cornea and those in contact sport. The aim of my study was to evaluate the outcomes of trans-PRK in refractive errors. This is a retrospective study including patients with refractive errors who underwent trans-PRK from September 2023 to March 2024. All patients underwent complete eye examination including intraocular pressure measurement, axial length measurement, keratometry, corneal topography using Cirrus Plus, and central corneal thickness using anterior segment OCT, and a dilated fundus examination. So this is all surgeries were performed using the Amaris 500E excimer laser Schwinn platform. So here is a video showing the procedure. So after anesthetizing, speculum is inserted and laser ablation is done in a single step, following which chill balance salt solution is given and mitomycin is applied. A soft bandage contact lens is applied along with antibiotic, and post-operative care included moxifloxacin with dexamethasone till the epithelium is healed, after which a patient was given fluorometholone for 1 month duration in tapering dose, and along with sodium hyaluronate drops and cyclosporin. Inclusion criteria included patients above 18 years who had a stable refraction for at least 1 year, patients were asked to discontinue contact lenses, and a spherical equivalent of between -10 to +6. Exclusion criteria included abnormal topo and keratoconus and other systemic diseases like autoimmune disorders, and no history of any ocular surgeries. Around 65 eyes were included in the study of 34 patients. Most of our population were females, and our population had more myopia and myopic astigmatism. The mean age was 25.8 plus or minus 5. The mean CCT was 533 plus or minus 32. The mean ablation depth we took it as 126 plus or minus 31. And post-operative residual stromal thickness was around 411 plus or minus 40.4. The visual outcomes showed uncorrected visual acuity improved from 0.8 to 0.02, and best corrected visual acuity was more or less the same. There have been improvement in all sphere, cylinder, and spherical equivalent. All near zero values were obtained, and p-value was statistically significant. So out of 56 eyes, all 99% had uncorrected visual acuity of 6/9 or better, and one patient had we had treated hyperopia around 4.25. So that patient had developed haze in post-operative haze in one eye, which was treated conservatively, and after 6 months the best corrected visual acuity has improved up to 6/9. And astigmatic, 7 patients underwent trans-PRK for myopic astigmatic correction. All of the around 85% had visual acuity of 6/9. Only one patient had a residual error around 2 diopter cylinder. So this is a case which I wanted to show here. She had a thin cornea. The myopia was around 5.2 and cylinder was around 2. But she had, after undergoing the trans-PRK, she had improved vision, 6/6 vision, and she's doing well for 1 year follow-up. This is another patient who had hyperopic correction. So this first patient, the first eye had plus, in the right eye it was +4. This was the eye which developed mild haze postoperatively, which was treated conservatively. Left eye was within normal limit. Other than that, we also looked for the higher order aberrations. So there was an increase in higher order aberration. From 0.3 it has increased to 0.6, and it was statistically significant. Coming to complications, overall complications were lesser, and only up to now we have got only one case of corneal haze, which was managed conservatively, and a single eye had a residual error, which was treated with spectacles, and she improved to 6.9. And there was no case of infections or significant visual loss. Coming to discussion, single-step trans-PRK is an effective way to correct refractive errors, and 99% of patients had a vision of plus or within one diopter of intended target refraction. And study was consistent with the previous study done in trans-PRK and SMILE and femtosecond LASIT. The study observed an increase in the higher order aberration post-surgery. The RMS value of 1 micron generally does not affect the clarity. 1 to 1.5 may cause blur. So in our study, we had got it as 0.6, which was reduced, and none of our patients complained of glare halos. So this is due to the smart pulse technology, which is incorporated into the machine, which gives a improved smoothness of the cutting and reduced ineffective energy. So along with that, the cold balance salt solution also reduced the chances of postoperative haze. To conclude, trans-PRK is a safe, effective procedure, and the technology, as it advances, is a preferred choice in the field of refractive surgery because of the efficacy and safety. Thank you. These are my references.
So does your study show anything new, anything different from the previous literature?
Most of the studies are done in myopia and high myopia. We are included astigmatism and hyperopia, and this is in our part of world.
Okay.
Sir, only one patient we did.
What happened to the patient who had a residual two-cylinder?
We corrected. She's
What was the pre-operative?
-6. Her other eye was -5.5. That was corrected. But
what happened to this eye? What was the reason? She was left with two-cylinder residual. No?
Sir, I think I have to study it more in astigmatic patients to come to a conclusion.
So you stopped doing regular LASIK, it's only photo surface ablation.
Better, sir. LASIK can cause ectasia.
So now it's totally you selected all the cases for surface, or you have any criteria to select it?
No, we do only surface ablations.